Did you know that your toothpaste contains a potentially toxic substance, but without it your teeth would quickly rot and decay? That substance is called fluoride. Hello, my name is Mitab Kangura, and welcome to my TALON Talk about how fluoride concentration affects tooth decay. This presentation will cover what fluoride is and what its uses are, what it does to teeth and why we need it, what happens during a fluoride overdose, and what happens to our teeth without fluoride. First, what is fluoride? Fluoride is the ionic form of the element fluorine. Fluorine is the 9th element on the periodic table and is a highly reactive nonmetal. Since it has 7 valence electrons, it only needs one more to fill its shell and become stable. Because of this, it easily reacts with other salts, such as sodium, which is why in nature it is commonly found in its ionic fluoride state. Fluoride can be found in soil and many foods, and it is added to some milk formulas, table salts, and water supplies. Fluoride has many uses, but it is especially known for its uses in preventative dentistry and oral hygiene. Fluoride can be directly applied to teeth in fluoridated toothpaste and mouth rinses, and it can also be found in over-the-counter supplements, such as fluoride tablets. It is usually found in the form of sodium fluoride, which has the chemical formula of NaF. Dentists can also apply gels, foams, or varnishes that contain very high levels of fluoride. Dentists can also prescribe mouth rinses with higher fluoride content for individuals that need more fluoride for their teeth. Some of fluoride's other uses include Teflon for nonstick pans, in some pesticides, and is also used in some medical screening such as PET scans. Now you know what fluoride is and what it's used for, but what does it do to teeth and why do we need it? The reason is that the tooth's enamel is in a constant cycle of demineralization and remineralization. Demineralization occurs when acids produced by plaque, bacteria, and sugars on the tooth surface attack the enamel. Unchecked, this can lead to tooth decay. Remineralization reverses this by redepositing minerals such as calcium, phosphate, and fluoride onto the enamel surface. However, without proper cleaning, demineralization can become too rapid for remineralization to repair. This leads to caries, commonly known as cavities. This is particularly dangerous as they can go unnoticed as they eat through the enamel and dentin layers. Since there are no nerves in this layer, they are usually only recognized when they reach the nerve deep inside the tooth, which causes excruciating pain. And by this time, the tooth is usually completely infected and needs to be removed. Fluoride plays a crucial role in preventing tooth decay that can eventually lead to caries. Fluoride prevents tooth decay by strengthening the enamel and acting as a force field, making teeth more resistant to acid. It also reverses early decay and prevents demineralization by redepositing itself onto the tooth surface. This helps speed up remineralization and reduces the potential for future tooth decay. Fluoride is especially important for infants and children between 6 months and 16 years. This is a time when primary and permanent teeth are developing and remineralization is required for healthy teeth. However, too much fluoride can impede tooth development, leading to white marks and streaks on the tooth surface called dental fluorosis. As previously mentioned, too much fluoride can be detrimental to tooth development. However, in high concentrations, fluoride can have many other acute and chronic effects. A toxic dose of fluoride for children and adults is 5 milligrams of fluoride per kilogram of body weight, with a lethal dose in children being 6 milligrams of fluoride per kilogram of body weight, and in adults it is 32 milligrams of fluoride per kilogram of body weight. According to data from the American Association of Poison Control, or AAPC, The main cause of fluoride poisoning is toothpaste ingestion, with more than 80% of cases occurring with children under the age of 6. It is essential that children have parental supervision when using fluoride-containing products to avoid poisoning, and it is recommended to avoid using flavored toothpaste as the taste encourages children to swallow it. Some of the acute effects of fluoride poisoning include nausea, vomiting occasionally with blood, diarrhea, weakness, and hypocalcemia, which is a deficiency of calcium in the bloodstream. These symptoms can lead to tetany, especially in the feet and hands, which is a condition that causes involuntary muscle spasms. Some of the other symptoms include hypotension, or low blood pressure, hypersalivation, and coma that can result in death. The chronic effects of fluoride poisoning and their severity vary depending not only on the dose or duration of fluoride intake, but also the nutritional status and kidney function of the individual. Some of the effects include dental fluorosis, skeletal fluorosis, gastric irritation, numbness, muscle spasm, and even cancer. The most common chronic effect is dental fluorosis. This occurs when excess fluorine is ingested during teeth formation. The excess fluorine impedes enamel development and leads to an overly porous tooth surface. Some of the defects can range from barely noticeable white specks or streaks to brown discoloration in more severe cases. Similarly, skeletal fluorosis causes overly porous bones, which causes them to degrade, leading to painful bone and joint damage. After learning about the risks that fluoride poses, it seems logical to move away from fluoridated products and switch to more natural or fluoride-free alternatives. This is further supported by the fact that toothpaste does not actually significantly help remove dental plaque. The motion of the toothbrush's bristles against the tooth surface is enough to remove the plaque. However, toothpaste that does not contain fluoride will not prevent tooth decay. Without fluoride, nothing is aiding remineralization or preventing demineralization. This causes teeth to more easily decay, as nothing is disrupting acid production. In an interview conducted by the University of Utah with Dr. David O'Connell, a periodontist with 30 years of experience, Dr. O'Connell mentioned that the only benefit that you'll gain is a fresher mouth with a natural toothpaste, but you will not receive any benefit against tooth decay if it does not have fluoride within it. In summary, fluoride plays an imperative role in promoting good oral hygiene and preventing tooth decay. Similar to most aspects of life, it is important to strike a balance. Too much fluoride and the effects could be disastrous, but too little and the benefits will not be received. So next time you're brushing your teeth, take a look at the toothpaste tube and see how much fluoride is actually in there, if any, and begin to appreciate the effects of the amazingly useful but potentially toxic substance, fluoride. Thank you for listening to my Talon Talk.